Hey everyone, and welcome back to this Clinical Explainer. Today, we're taking a highly visual journey through one of the absolutely most critical organs you're going to scan, and that is the liver. Now, I know you already understand the basic anatomy, the right lobe, the left lobe, the gallbladder, all of that. But the real magic happens when we translate that gross anatomy into actual ultrasound findings. Mastering these visual cues, it's completely foundational for any radiology student, because what you see on that monitor can literally change a patient's life. Okay, let's dive into this. So, how do we identify liver disease before serious complications develop? Honestly, as radiology students, this single question is the entire reason you're training your eyes right now. You guys are right there on the front lines of early patient diagnosis. Whether we're talking about fatty liver, cirrhosis, cysts, or tumors, early detection relies entirely on your ability to spot those tiny deviations from a healthy scan. If we can see those subtle changes early on, well, we can step in way before the damage becomes irreversible.
Section 1. The normal liver baseline.
Okay, so before you can start spotting pathology, you really need a rock-solid grasp of the normal baseline. You just can't recognize the abnormal if you don't know exactly what normal looks like, right? When you're looking at a healthy liver on ultrasound, you're hunting for three distinct things: a smooth outline, a uniform structure, and medium echogenicity. Basically, that means the brightness of the tissue on your monitor sits right in the sweet spot in the middle. It's not too dark, and there's no way it's blindingly white. The texture should look completely homogeneous and even. Think of it like a really smooth gray canvas with very clean, crisp margins. This is your anchor. Every single time you pick up that probe, this is the baseline image you should expect to see. Now, notice how we differentiate the vascular landmarks within that smooth gray canvas. This is such a crucial trick for training your eyes. If you look closely at the portal veins, you'll see they have these bright echogenic walls that practically glow against the background liver tissue. Contrast that with the hepatic veins, which you can actually track draining right into the inferior vena cava. Those hepatic veins, they don't have those bright walls at all. They're much, much more subtle. Recognizing the specific structural difference in the vessels is a massive part of confirming that you're looking at a healthy baseline. Section 2. Identifying fatty liver disease. Let's move to and see how this builds as we examine our first major pathology. There's a fact you need to memorize right now, simply because you're going to see it constantly in the clinic. Fatty liver is the most common liver abnormality, period. As a radiology student, this is going to be your bread and butter. Because of its sheer prevalence out there, mastering the visual identification of a fatty liver is quite literally one of the most practical, high-yield skills you can develop for your daily rotations. So, what's the very first visual deviation from the baseline we just established? Well, the primary shift is brightness. Remember that nice medium gray echogenicity we just talked about? When fat accumulates in the liver cells, it actually creates way more interfaces for your ultrasound waves to bounce off of. Because more sound waves are reflecting back to the probe, that medium gray canvas turns intensely bright and really reflective on your monitor. When you see that overall brightness jump up like that, your internal alarm bells for fatty liver should absolutely start ringing. But here's the thing. Fatty liver isn't just a simple binary yes or no. It stacks progressively. As the disease advances from grade 1 to grade 2 and ultimately to grade 3 fatty liver, a really fascinating, though definitely concerning, mini narrative plays out right there on your screen. As the fat increases and the whole liver gets brighter, the ultrasound waves actually struggle to penetrate deeper into the body. The result of that? The deeper structures of the liver become progressively difficult to visualize. By the time a patient hits grade 3, those deeper areas can completely disappear, totally lost in the shadow of the bright fat. The loss of that deep visibility is your primary indicator of advanced disease. Section 3. Cirrhosis and focal lesions. All right, we are now transitioning away from the widespread brightness of fatty liver and getting into more severe, advanced structural damage. When a liver progresses to cirrhosis, the visual story changes pretty dramatically. That uniform, smooth canvas, it's completely gone. Instead, you're hit with a really coarse echo texture. The liver looks rough, it looks nodular, and clearly damaged. Those beautifully smooth margins we saw back in the baseline become totally irregular and bumpy. But keep in mind, cirrhosis doesn't just affect the liver itself. It creates a whole cascade of systemic issues you can spot on ultrasound. We're talking possible portal hypertension, the buildup of fluid in the abdomen, which is known as ascites, and an enlarged spleen, or splenomegaly. It is just a complete structural breakdown. Now for a super vital differential diagnosis, distinguishing benign from concerning localized masses. This is definitely a high-stakes moment in the clinic. When scanning, you might come across a simple cyst. On ultrasound, a cyst is very distinct. It appears as a well-defined, perfectly black, round, fluid-filled lesion. It's clean. Now compare that to a liver tumor. A tumor often appears as an irregular, messy mass. And this brilliantly illustrates your absolute key differentiator. When you switch on color Doppler, a tumor will often light up with internal blood flow. Cysts are just fluid, so they stay dark, but tumors have a real blood supply.
Section 4, the diagnostic ultrasound checklist.
To bring this all together into a reliable, systematic anchor for your practice, you really need this 6-point checklist. A complete liver ultrasound should never be a random guessing game. You have got to systematically assess these 6 items every single time you scan. Number 1, size. Number 2, echogenicity. Is it bright from fat? Number 3, echotexture. Is it smooth or is it rough and coarse from cirrhosis? Number 4, vascular structures. Always track those portal and hepatic veins. Number 5, focal lesions. Scan carefully for any cysts or tumors. And number 6, color Doppler blood flow. So the crucial point is to memorize this exact sequence. Run through it every single time you pick up the probe, and you won't miss a critical finding.
And this brings us right back to why we actually do this. Running through that 6-point checklist isn't just some academic exercise to help you pass your exams. It is about real, tangible patient outcomes. Early detection helps diagnose liver disease before serious complications develop. Catching a grade 1 fatty liver or spotting a tiny irregular mass early simply because you knew exactly what baseline deviations to look for, that is the true power of ultrasound. Which leaves us with this final question to chew on. Are you ready to spot these early baseline deviations on your next clinical rotation? You now have the visual foundation, from the smooth, medium echogenicity of a totally healthy liver to the bright shadowing of fat, the coarse breakdown of cirrhosis, and the Doppler flow of a tumor. The next time you hold that ultrasound probe, trust your eyes, rely on the checklist, and look closely. Because what you find could literally make all the difference. Keep learning, keep scanning, and I will see you in the next explainer.